This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. You have the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit KappaBootScootin.com.
Hi there, welcome to Doc Talk. Doc Talk is the podcast put out by the Knoxville Academy of Medicine, which talks about health issues in plain language. I'm Elise Denaney. I'm former president of the Knoxville Academy of Medicine, and I am so pleased today that joining us is Dr. Robert Elder, who is the president of Women and Infant Center of Excellence for Health at the University of Tennessee Medical Center, Knoxville. And today's topic is really something that affects a huge percentage of the population, and it's called Midlife Women's Care. So I think I qualify for that. What is it?
I think you do.
Welcome.
But that's a good that's a good question. What is it? And a lot of us are getting older, and we're living longer, and we're more active. And if you think about the overall scope of a woman's life, at about age 45 or so to age 65 or so, that's sort of the midlife. Now at age 65, you can expect to live maybe another 20 years. And people are being productive on into their 80s. So now we're starting to see some specialization around that time of life for women between about age 45 and 65, because it's sort of a time to prep for what's coming next. Okay? And a lot of changes occur in a woman's life around that time, both socially and medically. One, it's a time when most people are peaking in their careers. It's a time when their kids are getting ready to go off to college. It's right before the average age of menopause, so there's menopausal changes on the horizon. And then there's other chronic medical problems that we know start to develop as we age, and you're more likely to be hypertensive, diabetic, osteoporosis. It's time when you need to get your first colonoscopy at age 50, so you've got gastrointestinal disease to think about. So it's a great time to sort of take an inventory and say, okay, here I am. I'm in my mid-40s. Am I healthy? Am I not healthy? What are my problems, and what can I do to improve this? And, I'm always amazed by the number of people that don't even have a primary care doctor. Well, if you don't have one by that age, it's a good time to be getting one, because, as you progress through your lifespan, you're more likely to experience some problems.
So the Center of Excellence for Women and Infant actually comprehensively addresses all of these issues that a woman faces between those ages.
Well, we certainly try. Mm-hmm. We have our system set up so that we can try to make sure that our patients are getting their mammograms, they're getting their bone densities when they're due. All our gynecologists, a lot of women, especially younger women, their gynecologist sort of becomes their primary care doctor for a while.
Yes.
And so all of us are really geared and encouraged to make sure that these patients are doing those type of screenings and testing that they need at that time in their life. And it goes all the way back to the first time we see them when they're young women. But to encourage them to get the mammograms, get their colonoscopy, have regular checkups, make sure they're taking their medications appropriately. Some of what we do in their annual visit and in working with their primary care doctors.
Well, that's great. And just going off the clinical track just for a second, because I'm very conscious of how much money we spend in healthcare, you addressing all of those issues actually helps save money for that individual, doesn't it? Because the insurance companies like it when you do that.
Yeah, we have seen, you and I have been doing this for a while. And we've seen a real change in the attitude of the insurance companies. Mm-hmm. Now, and I can remember when you know, their idea of saving money was the patient not being seen.
Right.
Now their idea of saving money is to keep the patient healthier.
Yes.
And you do that by making sure they get the appropriate testing and screening so problems are identified early on and taken care of, which I think is great.
It is. You're almost like a life coach. Mm-hmm. Yeah. Okay, so where does menopause fit into all of this?
Well, menopause, average age of menopause in America is 51. Now, if you want to get a measure, if you have an older sister and she went through natural menopause, that's a good chance that that's about when you'll go through it. Not concrete, but a good chance. Or if your mother went through natural menopause, that's another ballpark. But average age is 51. When that starts, it brings on some other issues that can be of concern. And now, not everyone has a difficult menopausal time in their life, but you know, everyone's different. But when you start that, then you start to have the concerns about bone loss. There's hormonal changes, the hot flashes, vaginal dryness, irritability sometimes. People talk about menopause brain. When my patients will come in and they'll say, I've got menopause brain, because sometimes they don't think as clearly or feel cloudy after they eat that. And so these problems need to be addressed. And then also sexual health, because sometimes intercourse can be uncomfortable after menopause because of dryness and that sort of thing. So this all needs to be addressed also.
Menopause is huge. I mean, we could probably talk for days on menopause because not all women are the same. I mean, it runs the entire gamut. I mean, and different years. I remember a couple years I was okay, and then in a couple years I could just stand in front of the refrigerator and still not be okay and still be miserable. So that is a huge issue, and maybe we'll do a separate podcast on that somewhere down the line, which would be great. So menopause, bringing that in, are there certain things that you look for? How often do we need to be seen for menopause? And
well, typically, sometimes I'll see a new patient who comes in just because of menopausal complaints. One of the most common ones is hot flashes.
right,
Or sometimes they'll have complaints.
they truly are miserable.
Right. Yeah. You do not have to convince me. But sometimes a patient will come in with complaints that they don't realize are associated with menopause, such as the clear thinking, not sleeping well, the irritability, decreased sexual interest, things that may be tied back to actual menopause when you sit down and talk to the patient and take a history.
Or maybe sometimes we think we're going through menopause, but our symptoms are actually indicative of something else going on.
Absolutely. And, it's not, for example, a patient may come in and complain of hot flushes, things like that. Maybe they've got thyroid disease.
Right.
So you don't just assume. You do a history and a physical exam and appropriate laboratory work to make sure that you made the diagnosis. But if it's classic, patient comes in with a classic history and description, then you really don't need a lot of lab work and evaluation to treat that patient.
Okay. So from 45 to 65, do I have to have annual screening for a lot of things? I know I need a mammogram and I need a colonoscopy.
Okay, colonoscopies is every 10 years in a person who does not have a significant history or does not have any positive findings. It may be 3 to 5 years in someone with a strong family history of colon cancer or who has abnormalities found at the time of the exam. Or if you have a young relative, first-degree relative, mother, father, brother, sister, who had colon cancer at an early age, you may need to get a colonoscopy 10 years before that person was diagnosed. So if they had colon cancer at age 53, you may need to get a colonoscopy at 43 instead of waiting till 50.
So when the neighbor comes up and says, oh, you don't need a colonoscopy except for another 10 years, that may have been true for him, but not necessarily true for you if you have a family member.
Absolutely.
It's all different.
Right.
And those recommendations for when you should do a colonoscopy are changing as we gather more data
Right.
on what your risk is given your family history and other diseases. Is that right?
Yes, and one of the things that happens, is people are living longer.
Right.
They're outliving the screenings.
Oh.
You think about, I had a patient come in not long ago, and she's regularly seen by a gastroenterologist, and she's in her mid-80s, and he said, you really don't need another colonoscopy, I mean, so, and so things like that. The other thing from my field is pap smears. First off is that everybody thinks they need a pap smear every year, right? Well, we now do dual testing where we do cytology and HPV screening, the virus screening, right? Well, those patients who are negative for both only need that repeated every 3 to 5 years. Then at age 65, if they've been 10 years and been negative, they don't need pap smears anymore.
We graduate.
But, we've learned more about the screening, and your risk goes down.
Okay.
So, and the problem with that is it's great because we need less screenings and that saves money, but many patients identify their annual exam with the pap smear. They don't say, I need to go get my exam. They say, I need to go get my pap smear. So we have to make sure we explain to the patients, this is a screening test you don't need anymore. You still need regular exams to make sure you're doing okay.
That's good, yeah, because you still may have symptoms that come up which are not related to what the pap smear screens for, but other parts of that gynecologic system in our bodies.
Right. Because pap smear really only screens for cervical cancer.
Right. Okay. All right. Now, from 45 to 65, health for women, we did the screening. Do we need vaccines?
Yes. What's recommended?
I hate shots.
Okay. Well, you did well, but think about how much you hate having the flu.
Yes, I hate having the flu.
And unless you really pay attention to what's out there in the news and you're in the medical field, you may underestimate the severity of a flu illness, but it can be deadly. People die in this state every year from flu. So flu vaccine, and that's age 45. That's yearly, and that's any age really. We give them very young, right? So, but we were talking 45 to 65 years old, so that's yearly. The tetanus, what's often called the Tdap vaccine.
Okay.
And that's tetanus, diphtheria, and pertussis, which is
Tetanus,
whooping cough.
diphtheria, and pertussis. Tdap. Got it. Okay.
But what's important about that, that's 5 to 10 years, every 5 to 10 years. And especially if you're around young children, you don't want to give some of those you wouldn't want to pass one of those respiratory diseases on to a young child. And that's why now that if a young woman has a baby, they will tell her that for people that are going to visit the baby, they recommend that they get their flu and tetanus vaccines are up to date.
Yeah, because, children die from whooping cough still. And I know they die from diphtheria on their throat. Okay.
And we actually vaccinate, postpartum patients in the hospital before they leave if they're not up to date.
Oh, that's a good idea. Yeah. And then the tetanus, that's the rusty nails, right?
Right.
Okay. So they get that from the soil. Yeah. All right.
And then as you get older, in your 50s, you need to think about the shingles vaccine.
Yeah, that's really horrible.
And right now it's difficult because there's a shortage, a new vaccine's a shortage, and many of my primary care colleagues tell me they're having difficulty getting that right now. But when it's available, you should take it. And then at age 65, the pneumonia vaccine, unless you have some other diseases such as diabetes, obstructive lung disease or something like that, you may need to get that sooner.
Right. If you have a pre-existing disease which makes it really hard for you to throw or to eradicate a bad infection in your lungs, smokers are really prone to that.
Right.
Okay. No hepatitis?
Typically, those are given earlier in life.
Okay. All right, and then I don't have to...
But of course, they do talk about now being aware of hepatitis C now in older adults.
Right, especially with the globalization of our world and new viruses coming into the States all the time with everybody traveling. Okay. Other things that we should watch for in midlife?
Well, okay, we talked a little bit about bone health. You know, women start losing bone mass at age 35. So thinning of the bones, osteoporosis, osteopenia, which is loss of bone mass, and then can be associated with spine or hip fractures.
So,
I
know you have women in your family. Do you make them eat certain things?
Well, I feel like most people, now, and this is an opinion, so I feel like most people get enough calcium in their diet. So I'm not big on telling people they need to take additional calcium, but I am a big believer in vitamin D. And I recommend that my patients and the folks take vitamin D3 in addition to the vitamin D they may be taking with their calcium supplement.
Absolutely. And I know so many women are on antacids, omeprazole and pantoprazole and lansoprazole, and that does affect how they absorb what they eat, right? And so do they have more problems with thinning bones?
You know, I'm not sure that I can answer that. What I do is I take my patients and I treat them. There's a couple of ways to evaluate them. There's the FRAX, F-R-A-X scale that you can do and get a woman's adjusted wrist for a hip or some type of osteoporotic type fracture within the next 10 years. And based on that, say whether they need to be treated or not. And then if I have a patient that's high risk, I sometimes will go ahead and ask them to go ahead and get a bone density in their late 50s instead of waiting until they're 65, because I don't want to find out at 65 if they're already osteoporotic.
Bone density scans. Ugh.
But if you use that FRAX scale, then sometimes you can delay those bone density scans based on the risk of fracture.
Okay, can I increase my bone density with exercise?
Yes. Weight-bearing exercise, which is walking.
Just simply walking?
Walking. Anything that is weight-bearing will help improve your bone density and prevent osteoporosis or osteopenia, yes.
Does yoga help?
You know, I'm not the right person to answer that because I'm not sure, but in my opinion, almost any exercise is beneficial. So I would probably say yes, even if I didn't know, just to get people to do it.
You have to walk to get to yoga, so that's good. And I know that they sometimes use weights, which is also weight-bearing.
Yeah.
Okay, well, that's good to know. Are there any other things that we should consider?
Well, it's like the other thing that I've been seeing recently in some of the literature is that there's an increased incidence of depression around the time of menopause.
Oh, right. Yeah.
And just something to look for and be aware of, that may have to be addressed. And it's a really great time in your life, in my opinion. I mean, you know, you're sort of settled, your career's settled, and you're sort of at the point you're starting to maybe enjoy all you've worked for. So now you need to work to be as healthy as you can be so you can enjoy it.
Yeah, and there's nothing to be ashamed of if you feel like you have symptoms of depression, because it's easily treatable and it doesn't mean you'll be on medication the rest of your life, right?
Well, again, what's one of the things that's been shown to help improve depression? Exercise.
That's true.
Can't get away from it.
That's absolutely true. So there you have it, midlife. Midlife for women is just a wonderful time of our lifespan, 45 to 65, and unique in that in very many ways with our life goals as well as our biologic goals. So if you have any questions regarding midlife for women's care, you can direct them with Dr. Bob Elder. And how do we get a hold of you?
Our office number is 305-5940 here in Knoxville. And also we have several other excellent gynecologists at UT Medical Center, which I'm very proud of, that can take care of you, and we would love to have you see one of them.
Yep, and it's a multidisciplinary team, so you get more bang for your buck, which is really good, because then nobody likes to be in the doctor's office if they don't have to be. So that's a wrap, and we hope you'll join us in the future. Thank you.
This episode of Doc Talk is brought to you by The Kappa Boot Scootin' Ball featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. You have the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.